We're recording now.
Okay, hey everyone. This is our presentation on social class and healthcare disparity. Okay, so to start, we were looking into the research question of what is health inequity and how does it relate to social class? As we started, we kind of looked at all different variables that would relate for social class and healthcare. And what we decided to focus on was insurance coverage. So our initial hypothesis ended up being that people of a lower social class will have a more difficult time achieving health equity. So sorry. And so in our literature review, we found that private insurance coverage is inaccessible for most of the US population. And so what we found was that there's a need to explore health insurance types when it comes to minority demographics, which ended us looking at Medicaid.
Okay, so I have a few tables here. So the first table looks at whether cost was a barrier to seeing a healthcare provider as it relates to an individual's income. So looking at individuals below the federal poverty line, 44.2%, there was a cost barrier to seeing a provider. And then at 55.8%, there was not a cost barrier. And then above the poverty line, 19.5, there was a barrier, and 80.5, there was not. And then there were a few common healthcare issues, as it relates to uninsured and insured low to moderate income level. So one of the biggest ones was not having other affordable options and not having a regular primary care physician. And one important aspect of health equity that is often overlooked is prioritizing education and treatment resources for low-income families. And intervention is necessary because offering equitable health care leads to a more effective healthcare system, a healthier general population, and it would require less medical care for patients.
Perfect. So the overreaching goal of our intervention is to educate Medicare users and those who qualify for Medicare or Medicaid, on the services available to them in hopes of making them more comfortable with their experience of using insurance and creating more quality. So our objective for this would be to provide insurance to those who don't have it and educate those who do have it, and to increase the quality of healthcare experiences overall. The main population that we are looking at is low-income US citizens under the age of 65. And the way that we plan on doing this, the method is connecting to those who already utilize Medicaid and those who qualify and bring them together for an information session. We want to connect with other organizations and resources in our community that might have connections to those who are low income or qualify for this insurance, and then have them either meet at a location so that we can have an information session, or make it available on Zoom or other video platforms for them.
And then how we are going to evaluate this program. Our program is going to be evaluated through the use of a pre-intervention and then a post-intervention survey. Before the Medicaid information session, we will give them the pre-test, and then our plan is to follow up with them via email, or they can also opt into physically receiving that 3 months after the intervention with the same survey to see how their utilization of their benefits and services has changed. This data we collect will allow us to assess our intervention's effectiveness while also educating the Medicaid population about their insurance benefits and aims to reduce health inequity. And then over here is the actual survey we would give them. Just quickly, I'll go over that. First question is, when is the last time you sought out medical care? What factors may prevent you from seeking medical care if you need? And are you familiar with all the services your insurance provides? what services do you utilize through your insurance? And that's where we would want to see the change from the pre and the post survey. And then, are you satisfied with your insurance?
Okay, so that wraps up our presentation on social class and health and equity. We hope you all enjoyed and learned a little bit more about Medicaid interventions.